This is a condition where the lining of the uterus, the endometrium that normally goes during menstruation, grows in places that it shouldn't do, outside the uterus. It's a chronic inflammatory condition, and it affects about 10% of women and girls globally. That's 120,000 women in Aotearoa. 30 to 50% of these experience infertility. And this condition causes pelvic pain of varying degrees. This condition is massively under-recognised, under-diagnosed and under-treated. In 2024 in Aotearoa, there was a study and it found it typically took people at least 10 years or 5 doctor visits before they'd be diagnosed. Another recent study in Aotearoa asking in those that suffer with endometriosis found that 81% avoided sex because of chronic pelvic pain. 87 said that their pelvic pain affected their relationship with their partners. Some 32% said in the last 3 months it affected their ability to attend work and just carry out day-to-day activities. And a high percentage, 70% or more, said that they were afraid to tell their employer in case it would affect their career perspectives. There are roughly 4 stages of endometriosis, but it's not reflective of pain or symptoms. It involves the first stage where the endometrial tissue haven't implanted anywhere, and then it progresses where they start implanting into small patches or have surface lesions. This can typically affect the ovaries, the fallopian tubes, or tissue lining the pelvis, but rarely it can also go outside the pelvic region. At stage 3 and 4, you can start getting fibrosis and adhesions, that's like scar tissues, to the extent that it causes changes in the anatomy. So, for example, an ovary may stick to the pelvic wall. Symptoms often align with monthly cycle, so including those painful periods, excessive or regular bleeding, bladder pain, bowel problems, including constipation, diarrhea, IBS, lower back and stomach pain, pain with sex, fatigue, and as we've mentioned, infertility and pregnancy risks. This can massively affect these women and put them at higher risk of both chronic pain and poor mental well-being. Endometriosis can sometimes be diagnosed by ultrasound, but often has to be done by surgery, but if it's found, but it can be missed. There is no known cure, so treatment is only managing the symptoms and trying to lower the estrogen to lower the growth of the endometrial tissue. Self-care is really important, so with diet and some complementary therapies can be benefit. Pain relief, anti-inflammatories and birth control pill. Laparoscopy may be done to remove endometriosis, and for more acute women that are impacting, the pelvic pain is impacting their function, they may end up going for a hysterectomy, so removing their sexual organs, including the ovaries, which can put them into surgical menopause. Adenomyosis is another condition where the endometrium is within the muscular wall of the uterus, and that can happen alongside endometriosis or independently. This diagram here is showing the endometriosis and where it can infiltrate the colon, can affect the ovaries, can grow on the outside of the uterus, cause adhesions to the pelvic wall, where adenomyosis is within the muscular wall of the uterus.